As the federal government shutdown enters its third week, President Trump promises he'll slash more funding and carry out more firings. He says he'll target Democrats with those cuts. But in his rush to inflict maximum pain on the opposing party, there's already been plenty of backtracking, mirroring some of what we saw in the chaos of DOGE cuts earlier this year. The latest confusion coming at the CDC, where over 1,000 employees were sent layoff notices on Friday. But the Washington Post reporting that 740 of those notices were rescinded just a day later. We're joined now by one of those CDC staffers affected by the whiplash, Erin Melton Backus, who has been laid off and rehired 3 times under the Trump administration and is on leave as lawsuits play out over the Trump cuts. Erin, thank you so much for being with us. You've organized workers in response to this year's terminations. The White House says more firings could be coming. What's it been like for you, your colleagues that have been impacted by the cuts, the reversals, and the reinstatements?
Yeah, it's been a really confusing and frustrating time for a lot of us. People don't know what to expect next. And, you have some of us that have been on administrative leave for quite a while the legality of our firings is playing out. And then you have these new people who were fired just this past Friday who are also wondering if that's going to be the same situation for them. There's already a lawsuit in court from the federal unions challenging the legality of the reduction in force that happened on Friday.
Yeah, for so many federal workers, the paychecks have stopped coming until the end of this shutdown. If this goes a month, maybe more, tell us about the impact that will have on you.
Yeah, for me, luckily, I have been able to save and I have a little bit of, money set aside so that if this goes on for a while, I'll still be able to pay my bills. I'm also blessed that I have a partner who's able to support me. But I know a lot of other people are not in the same situation. And you also have people like the Capitol Police, like air traffic control, even people at CDC who are considered essential and are having to report to work without pay. So if they were to have to, take on another job to pay bills, they might not have the time to do that.
Were you given any explanation each time you received that pink slip?
Yeah, so the first time was in February, and I was told that I was being terminated for poor performance. And we, later found out that that was not true, that it was illegal. I had actually just had a promotion, so I knew for a fact that that wasn't true in my case. Then the termination that came in April was part of the April 1st reduction in force at CDC, and we were told that our program was duplicative, that it was wasteful, and that in order to streamline the programs at HHS, that my program, which was the Office on Smoking and Health, was no longer needed. And then this final one, we weren't really given a reason. It was just, kind of general language about government-wide restructuring. And then that, notice was later rescinded because my program is not allowed to have any more cuts while the first lawsuit plays out in court.
No doubt this is sowing a lot of confusion. We've been reporting that the Trump administration is using some official government communications to blame Democrats for this shutdown. The debate over whether that is legal or not, it continues. But have you seen any of that in the official correspondence with CDC employees?
Yeah, so you can see it, for the public, it's on the website, the CDC Gov website, it's on the social media, but then also when the furlough notices came, there was some language in our notice that, it was a Democrat-led shutdown. I don't think the language in our letter was quite as strong as some of the other ones that I've seen, but it's definitely been happening across the government.
How do you think that these CDC cuts are impacting public health? And I got to ask you, what's keeping you motivated to continue in your government position in this chaotic climate?
Yeah, they're already impacting public health. We've seen over the past month a lot of confusion over who can get COVID-19 vaccines, who, if insurance will pay for them or not. People are reporting issues with access. We're also going to start seeing some issues at the state level where funding might not be coming through after the end of this fiscal year. So if people don't know, about 80% of CDC's budget goes back out into the communities and is used to support programs at the state and local level. And so far, there's been delays, but people have largely been able to get that funding, but that might not happen going forward.
Yeah.
To stay motivated, I just very deeply believe that public health is one of our most important tools to keep our nation healthy. It doesn't care if you are a Republican, a Democrat, an independent, and oftentimes it works in the background without you realizing it. And so I'm motivated to keep fighting for that.
And I should point out to our viewers, the video they were watching was of top CDC officials as they resigned in protest of what they see as tumult going on behind the scenes to the detriment of all of us, as you mentioned. Erin Melton Backus, thank you so much. We appreciate your time.
Yeah, thank you for having me.